with a prayer. We'll start this particular conference and this webinar with a prayer in my traditional language, which is Navajo. And we'll just start now. Alane shema yada fletchia dishigo kore. Hinane kedo hilnata wila data. Nihala hidden hata nitsendo. Has two on his only than the by heta nitsen. All the gender who now hate ashiat not a kato that they done nitsen, that the neko. Dishigo aya. When she had the data, so there's an a nanish slit of the by Henson. Though the con he get either he can know. By Henson, the love there, now Shka, the ship. Hajan Hustling, Hajan Hustling, Hajan Hustling, Hajan Hustling. Thank you, Edie.
Thank you so much, Larry, for that prayer to start us off with for today's webinar. Thank you all for joining. My name is Edie Yao. I am your moderator for today's webinar called Addressing Alzheimer's and Dementia in Indian Country. And really thrilled to be joined by our panelists. First of all, let me just say that part of this webinar is to honor and celebrate Native American Heritage Month, also called American Indian and Alaska Native Heritage Month. And one of the things that we're bringing you all together for is knowing that Alzheimer's is a serious epidemic in this country. We know that 1 in 10 people over 65 are impacted by Alzheimer's. And as American Indians and Alaska Natives are also living longer, the numbers are even more staggering. It's about 1 in 3 over the age of 65. And with as many people affected by this, we wanted to bring together our esteemed colleagues here from organizations that are doing really good work in this space. And so to learn more about what they're all doing, we're going to try and pack it all in 1 hour, but to really understand how we have to collectively address Alzheimer's in so many different ways. And so I am joined today by Larry Curley, Executive Director of National Indian Council on Aging. We also have Dr. Jolie Crowder, who is the National Elder Services Consultant in the Division of Clinical and Community Services with Indian Health Service. And we have Marianne O'Mara, Public Health Communications Associate from International Association for Indigenous Aging, also affectionately known as IA². And we have Eva Jackson, who is the Associate Director for Healthy Brain Initiative with the Alzheimer's Association. So to kick off our conversation today, perhaps I'll start off with you, Larry, because I know you have been in this field for quite some time and have a lot of experience in working with elders and advocating on behalf of American Indian and Alaska Native elders. And so as we're talking about Alzheimer's and dementia, have you seen an increase in the concern and awareness about Alzheimer's in, say, the last 5+ years or so? And if so, what are some of the issues that you're seeing? I believe you need to unmute.
Yeah, I'm just used to just watching people's lips moving. And but anyway, thank you for the question, Edie. Yeah, I've been involved in this whole field of aging for over 40 some years, and I've seen a lot of changes in those years. I remember back in the mid 70s when I first started in the field, Alzheimer's was an unknown. No one talked about it in Indian country. And as the years went by, because a lot of our older people back then were saying that this is a non-Indian disease. And so they kind of just dismissed it. But over the years, I find that in the last 10 to 15 years, we're finding that a lot of our people are beginning to be diagnosed with Alzheimer's or dementia, and they're becoming aware. I think a lot of it because a lot of information is not going out to Indian country. There are studies that are out there that are being done in Indian country. There's a push now as well at the national level in the congressional field of doing clinical studies that would involve a diverse population, including American Indians. So I think that there's information that's beginning to be put together so that we can begin to understand more fully. And I think one of the things that we've been doing here at NICOA, National Indian Council on Aging, is that we're hearing a lot about the caregivers out there. There are not very many caregivers out there who are especially trained in taking care of people with Alzheimer's. And there's always that propensity and the danger of burnout among our elderly population who are providing care. And I think that the information that's been available to Indian country has really increased significantly over the last 10 years, I would say. I think a lot of the work that has been done by you, the association, and by people like the IA squared, all of that has made Indian country more aware that it is not just a white man's disease. It is a disease that is prevalent. The incidence rate is going up, and so the knowledge and at least awareness has gone up in these last few years. And we do our part by making sure that the information that IA Square comes up with, things that Jolie Crowder has done, the work that you and I with the Alzheimer's Association, that we make it available to the population that we serve. We now found that we have over 6,000 people who subscribe to our website. So they visit our sites. And so we have a population of 6,000 and it's increasing, I understand. So, but we try as much as we can to make that information available. And we do things like, for example, we just recently did a presentation at the National Congress of American Indians Conference in Sacramento, California, and did a presentation. And part of the presentation was the facts about Alzheimer's and related dementia. So from our side of it, Edie, I think we're doing what we can, but I think there has been an increase of awareness and information out there in Indian country about Alzheimer's and related dementias.
Yeah, thank you. Thank you for that. And for some historical context, right? And people didn't really see Alzheimer's as an issue before. And, you know, I remember over a decade ago, maybe 20 years ago, attending a health fair at an Indian health center. And people said, frankly, we don't see people living long enough to develop Alzheimer's here. And we did a study recently in our special report that the Alzheimer's Association put out last year called Race, Ethnicity, and Alzheimer's, where we did include American Indians in this survey. And more than a third of Native Americans say that they do not expect to live long enough to develop Alzheimer's. So there's still some of that. And yet we have also seen that 2/3 of American Indians say that they know somebody with Alzheimer's. So it is really important that NICOA and other organizations really help get the word out. So let's turn it over to Dr. Crowder from Indian Health Service. And Jolie, if you could share a little bit about what IHS has been doing to address Alzheimer's. And you will need to unmute once you're ready.
How about that? Are we looking good?
Perfect. Yep.
Excellent. All right. Took me a second to get everything oriented. So I love slides because they keep me on track, and I've only got 7 minutes with you guys today. So want to be cognizant of that because there's lots of great stuff to share. So thank you everybody who's on the line for the opportunity to be here today. And Edie, especially thanks to you for convening this call bringing all of these great folks together. It's really great to see everybody on the line, both our presenters and participants, and really what we've noticed is this increasing attention for dementia and efforts to address dementia in tribal and urban Indian communities. So this slide is a quick visual of our small but mighty new-ish elder health team. I've actually been in this position at Indian Health Service for all of 2 months, having moved over from the nonprofit world for about 25 years. And trying to kind of quickly come up to speed with sort of systems and how things work, and all the great work that's been accomplished already by Dr. Bruce Fink, who many of you likely know, and is thankfully still a key part of all of our work in this space. The new Alzheimer's funding that we received in 2021 at IHS is really the first dedicated appropriations for almost any type of elder health programming or work that we know of. So it's really exciting for me to be able to come here and kind of at the ground level of work in this space. As I said, I most recently came from IE Squared, where I worked with Marianne and Bree and the team there, and we were working on creating products and all sorts of good stuff in different ways. And worked there for about 10 years. So come with experience working with tribes, urban Indian and Alaska Native focused projects and communities. And in the last 4 or 5 years, very specifically on dementia focused work. And I really hope that, bringing my experience in both healthcare as a nurse and QI and more importantly, really as a federal grant recipient, really helps to lend to my capacity to help sustain and support the development of this program. Valerie Jones, another awesome new staff person, in her role brings some great experience as well with long-term services and supports and program administration and her work with Navajo Nation. And so I think we make a really great team, rounded out by Dr. Fink and then our division director, Dr. Ronyak. I think I'd start by saying that we all as a team, and I think even in our work at IE Squared, we really recognize and respect the nature of our work with tribes as sovereign entities. And, personally, my mission as we go about setting up this new work is fulfilling the priorities and guidance that's been provided to IHS by tribes, tribal leaders, and urban Indian organizations during the consultation and confer process that we underwent last year. That's really sort of our guidepost in the work that we're developing. About sort of the term Alzheimer's Grant Program, which is the language that created our program. So I have more slides and time, so I'm going to talk a little quick and then probably just skip through a few too. So this one's probably the most important as a visual. Dr. Fink created this, and it's to convey kind of the intent and plan for our work. And this was crafted in direct response to that consultation and confer process. Internally, we talk about our work in buckets, the largest of which you're going to see at the top, which is getting money out to tribes, UIOs, and IHS service units. The other buckets or elements or circles that you see on there were items that were identified in the consultation process and really designed to directly connect and support the big bucket of grants and program awards, as well as provide some expanded opportunities for the ITU healthcare staff by way of clinical education and training, which will include caregiver support systems and coaching efforts that you'll see on the left-hand side. And then on the right, you'll see outreach and awareness bucket. One of the other things we heard pretty clearly in that consultation and confer process is a priority for tribal staff to become knowledgeable and aware and sort of become proxies for and champions to serve in their own communities to raise awareness about dementia. And finally, the smallest, but some might say most important if you're kind of a data person like me, is the bucket at the bottom, which is program support and data. That really includes myself and Valerie and Bruce, but more importantly, it's an effort to identify data on incidence and prevalence within the health system, and then other markers, all of which is to help support and guide those programmatic efforts. So that outreach, the education, and then the grantees local work. I'm not going to go into the details of this other than to say that we have 4 new amazing grantees on board. We have 1 in Minnesota, we have 2 in California, and then 1 in Idaho. And then you can see the details of the types of things that they plan to focus on, which is, probably too much detail, but really the goal is for them to create models that work in their communities and work for their health systems. Let's see, what's next kind of in the grants and program award space. You will note our intent to offer additional funding opportunities for tribes and UIOs in 2023. If you aren't already signed up for our elder care listserv and or on grants.gov, I'd strongly suggest that you do that. That's a great way to stay on top of these opportunities as they unfold in the coming year and thereafter. And the listserv, I think, will be a great mechanism to hear about, pre-announcement or announcement webinars and those types of things, as well as we share other, webinar content like this. Let's see. So for, we've got 2022 training and education. I think, again, not going into a whole lot of detail, really just to point out that we've already got some small pilots efforts underway, including our geriatric scholars program that we're developing in conjunction with Dr. Jolie Crowder and her team at the VA, who really spent years refining and perfecting their approach to training and education in this space. We do anticipate recruiting another round of Geri Scholars later in 2023, and also excited as we start to be able to share results from the current cohort as they're working on their projects. As IHS has been standing up the Alzheimer's grant program, we're also looking to collaborate on many different avenues, provided dedicated funding to support each of those focus areas of the buckets that we talked about. One of the other things that we heard very clearly is the need for workforce training and enhancement for the ITU staff. We started with funding for the first 4 grantees, and now we're really at the stage of building support for those programs, as well as other clinical staff throughout the system. And I think we have a lot of promising opportunities in this space. So keep an eye out in that area for some of the things that you see on this slide, plus other activities that we have. At the end of the day, I think that last slide really is about opportunities and partnerships, and I think we recognize the value of that in our work. 2023 outreach and awareness plans, that bucket that was on the right side. We're planning for a strategy that's focused on outreach and awareness and building support for Indian health system staff, which is another place that we do see for opportunities and collaborations. And I've put another plug in for the elder care listserv on this one. Really, the idea is to build a system-wide community of champions using lots of different opportunities so that it can, meet the needs of folks where they are. Data was that 4th bucket. And again, I think foundational to our efforts and hopefully to the program efforts as we get underway in that space. And you can see a few of the things that we have in mind, including the development of the data dashboards. The evolution of data and access and those types of things are probably going to take a fair amount of time and effort, but moving in that direction. So I think that's probably it for me. I cheated and wrote down some notes for the talking points, and I will stop sharing. And hopefully it didn't go too far over.
No. And Jolie, we already had a question about the listserv. So while I introduce Marianne, if you could put in the chat the link for that IHS elder care listserv, we'd love that. And we do have some questions. So if you have any questions, please go ahead and put it in the Q&A function, and we're trying to have some time afterwards to address some of these. So, and thank you, Jolie. I know the Alzheimer's Association, we're thrilled to be partnering with IHS and to support all the great work that you're doing, and that together we can try to support all of the tribes and urban communities as well to address Alzheimer's. So next we have Marianne, who will talk a little bit about their work. And IA Squared has been such an important and integral influence in the roadmap for Indian country through our Healthy Brain Initiative work, but I know you all do so much more. So I'm going to turn it over to you to share what you all do.
Can you see that okay?
Yes, I can. Thanks.
Okay. So hi, everybody. My name is Marianne O'Meara. As she said, I am the Public Health Programs and Communications Associate at IA Squared. And I want to say thank you again for having me here today. So IA Squared works to advance both knowledge and practice and promote engagement at all levels, national, regional, and local. We acknowledge the history, rights, cultures, and value of Indigenous people throughout their lifespans. Responding to the needs of those we serve, we generate research, we bring together stakeholders to identify approaches to cross-cutting issues, and we work to bridge the gap between policy, research, and practice. We have successfully implemented projects that tapped into our staff and network of our partners' abilities. So the 5-year CDC, or Centers for Disease Control and Prevention, funded project established IA Squared as a national hub for Alzheimer's disease and related dementias, or ADRD, information resources serving Indian country. IA Squared provides training, technical assistance, and resources for tribes, tribal leadership, healthcare, and public health staff, urban Indian health centers and organizations, and tribal elder services and advocates across the country. Activities are designed to advance community engagement and help build capacity among tribes and tribal members serving organizations, promote healthy cognitive aging strategies across the lifespan, and foster dementia-capable tribal communities. So our products are designed by and designed for American Indian and Alaska Native communities. IA Squared has taken a diligent effort to involve community members, elders, Title VI, as well as our National Advisory Board in the creation and development of the products that we have produced. These conversations and gathering of feedback allows us to transform information into visually appealing and meaningful products that are developed proudly by and for the community. So now I'll be taking the next few minutes to introduce you to a few of the products and the services that we provide. Law, regulation, and policy are all understood to be essential public health services and tools to promote health equity and improve public health. So in response to that, we have recently released the report, Tribal Law and Policy, Alzheimer's Disease and Related Dementia Issues, which explores how federal and tribal law and state policy actions are currently addressing these issues. We have also created a flyer with 10 signs of thinking and memory changes that could potentially be signs of dementia, specifically for American Indian and Alaska Native communities. This content was co-created in conjunction with the American Indian and Alaska Native Brain Health Advisory Group, based upon content and adaptations from the Alzheimer's Association and the University of Wyoming. We also offer several different designs to target different audiences and are currently offering a printing stipend. We have revised and updated a 2-page flyer about dementia risk reduction intended for American Indian Alaska Native communities and tribal serving organizations to use. The changes included updating statistics, writing in plain language, and updating the designs. It can be distributed through senior centers and intertribal organizations, healthcare facilities, administrative offices, tribal newspapers, radio stations, and as a mailer. We also are starting to release our planned series of 6 nutritional rat cards. This healthy eating focused message series includes practical advice as well as a culturally relevant recipe. The rat cards can be distributed through senior centers, intertribal organizations, healthcare facilities, administrative offices, tribal newspapers and radio stations, as mailers to tribal members, etc. Tribal meal delivery programs can also incorporate weekly distribution for in-person and home delivered meals. High resolution files are available for download on our website. And remember to stay tuned as the other cards will be released soon. In the near future, we are planning to release additional information products, including the RAC cards I just spoke about, an ADRD state plan resource guide. This guide is a resource to aid in ADRD policy and planning for AIAN communities, leaders, and state and local public health entities. We're also planning to create a sample tribal resolution addressing ADRD, as well as a social media toolkit culturally tailored to American Indian, Alaska Native communities, and an updated dementia risk reduction graphic. Another one of our initiatives for which we're developing educational resources for is the Creating a Tribal Elder Safety Net to Address Wandering. This project is funded by the Department of Justice. So the purpose of this project is to prevent wandering among tribal elders living with Alzheimer's disease and related forms of dementia, and develop a robust wandering search and rescue support strategy for the Pyramid Lake Paiute tribe, and create a replication guide to benefit tribes nationwide. So far, we have created a person profile template to be filled out with elders' information to be added to a database in case they were to ever go missing or to wander. We are continuing to develop resources that will serve tribal elders, especially those living with ADRD, their family, caregivers, tribal police and first responders, tribal elders and social services, members of the Pyramid Lake Paiute tribe. Information can be found on IA2's website about dementia wandering and the resources regarding that. That brings us to another one of our initiatives, Dementia Friends for American Indian Alaska Native communities. Dementia Friends is a global movement that aims to change the way people view dementia by educating communities about what dementia is and how it affects people. This program shows how we can all make a difference for people affected by dementia. IA2, in collaboration with Dementia Friendly America Nevada and various community members, adapted the Dementia Friends material specifically for American Indian Alaska Native communities. Dementia Friends for AIAN communities aids in spreading awareness, reducing stigma, reducing risk in tribes and urban Indian communities. If you are interested in becoming a Dementia Friend or a Dementia Friends champion, and you want to learn more, IA2 is hosting the next information session on November 29th. And again, you can register for that as well on our website. IA2 also offers leadership and practical assistance in program evaluation and research, often in complex environments and in a wide variety of areas, from education to business and industry to nonprofit, as well as government agencies. We are starting to work on developing an evaluation resource library, including best practices and case studies. So be sure to stay tuned for that as well. I do want to thank you all for your time and for listening. To learn more about us, be sure to visit ia2.org. You can download our resources here. You can learn about cutting edge efforts. We have an events calendar and much more. And if you would like, you can subscribe to our e-news by scanning the QR code here on the slide. Otherwise, I just want to say thank you, and here is my contact information.
Thanks so much, Marianne. Those are terrific resources, and I know we already got a question of how can we get the RAC cards and the warning signs flyer, and so if you could put in the chat to everyone your website, and if there's a specific link for the RAC cards or anything else, I think that'd be terrific. Thank you. Well,
yes, I can do that now.
I think that work is a great segue to Eva Jackson, my colleague at the Alzheimer's Association, who focuses on the Healthy Brain Initiative and really taking a public health approach to this work. So Eva, if you could share a little bit about how we're approaching this from your end.
Yeah, I'd love to. Are you seeing the slides okay?
Yeah, thank you.
Okay, yeah, so as Edie said, I am on the Healthy Brain Initiative at the Alzheimer's Association. I'm just very honored to be here today with these other leaders who've been doing so much amazing work in this space. So I am going to be sharing a little bit about the Roadmap for Indian Country and some of the work that's been done using it. And I do want to mention that the Healthy Brain Initiative is a cooperative agreement as well with the Centers for Disease Control and Prevention. All right, so I am on the public health team at the Alzheimer's Association. And so one way that we think about Alzheimer's disease and other dementias in public health is to think about it across that life course. And so we think about what we can do from birth all the way until someone does pass away to reduce risk for developing Alzheimer's disease and other dementia. We look at ways we can help with early detection and diagnosis, and we look at ways that we can improve the safety and quality of care. And that's both for the person with dementia as well as their caregivers, friends, and other family members. And so thinking about dementia in Indian country from this perspective, we know that we need some of those public health strategies to help create those healthy communities that really can reduce the risk of Alzheimer's disease and dementia, as well as other chronic conditions, and just ensure that there's equitable access to early detection and diagnosis and treatment for everybody. So as Marianne mentioned, we published the Roadmap for Indian Country, and that was published in 2019. And that came out of a recognized need for guidance that was tailored to the unique needs and strengths of American Indian and Alaskan Native communities. And so this was done with input from tribal leaders throughout Indian country who recognized dementia as a growing problem within their communities. And so we worked together to develop this framework that really promotes some of these community priorities as well as tribal heritage. So when we use the Roadmap for Indian Country, really hope that the approach is that organizations will use it as a conversation starter. It will be used to help prompt some of that local planning and help develop some of those public health strategies. So I want to share a little bit about the work that we did. We partnered with the National Indian Health Board to offer mini grants to implement the Roadmap for Indian Country with tribal organizations. So I'm just going to talk through some of the work they were able to do. So the first one is the Mount Sanford Tribal Consortium. It's in Alaska, and they worked with their community health aid practitioner or CHAP program. And so some of the things they did were they trained their clinic staff and administrative staff on the changes of aging, just kind of looking at what's normal versus what might be a little more concerning, so that if they did notice something, they could tell the clinical provider and they would be able to communicate with the family about that. They also added additional screening questions to their community health aid manual, and they're continuing to raise awareness by arranging supportive gatherings in person for their elders. Another thing that they did was they worked on frequent home visits to their elders. So they were able to spend more time with their elders to gain a better holistic perspective on how they're managing their daily activities, their nutrition, some of their safety concerns. And the staff and the elders really enjoyed these longer visits and felt they were able to communicate better when they were at home rather than when they'd gone on a long journey to see a doctor or were feeling really ill. Another group is the Cheyenne and Arapaho tribes in Oklahoma. And so their Department of Health attended 2 large annual elder outreach events where they were able to share information about Alzheimer's disease and other dementias. They worked to design and develop the public service announcements, and they published those in the Tribal Tribune, on TV stations, on their Facebook and social media websites. They also did some of that training of frontline healthcare staff that we've talked about the need for today. And then they were able to also do some home visits and distribute a questionnaire to elders. And they shared, after their team presented to a legislative body, one tribal elder actually shared that they were impacted by cognitive decline and were experiencing some challenges. And this really led to a place for that elder to become a strong advocate for the cause and was able to share some of that information through the tribal legislative channels. And that was really effective. The next community is the Sakagan Chippewa community in Wisconsin. And so they worked again to just educate and empower their tribal members really on the importance of early detection and treatment. And they did that by providing information and tools to older adults with dementia, as well as their caregivers, really working to reduce stigma to help improve that dementia risk reduction across their lifespan. And so they were attended to outreach events where they gave out information and referrals. They're still developing a brochure that they're going to be mailing out as a resource, and then continuing to offer other training for family and caregivers. And then the fourth community is the Loop community of St. Paul Island, located in Alaska. And so they really emphasized growing a partnership between the Aleut community of St. Paul Island Tribal Government's Department of Healing and Wellness with the South Central Foundation. And so they worked together to create trail maps and flyers and worked with community members and caregivers to present those at local health fairs. They also worked to educate their work staff about aging services and some of those signs and symptoms of dementia. And they had several caregivers attend those training sessions as well. One neat thing they did was they added local brain healthy foods to their elders program and to their food demonstration courses. And they worked to create care plans for caregivers to help with their in-home support services. We're currently working on a video for the community and providing ongoing training for community members and caregivers. And they worked again with the South Central Foundation. They were able to learn more about services in Anchorage and how they could be combined with their local services, or see if any of those services could be moved to be local in St. Paul. And this just really strengthened that relationship between those two agencies, so that if someone does have signs, they're able to get that member connected with the right organization. And then I want to share a new recipient that we're really excited about. So the Alzheimer's Association and the National Association of County and City Health Officials, or NACCHO, we've announced our second cohort of the Healthy Brain Initiative Roadmap Strategist Program. And one of those recipients is the Aleutian Pribilof Islands Association. And so through the Roadmap Strategist Initiative, this tribal health organization will be working to increase their capacity to address brain health in their communities. So they will receive direct funding, training, and technical assistance. And with guidance and peer support, the strategists are going to be conducting a public health needs assessment. They're going to be training local officials and key community partners, and they will be really leading the implementation of public health action on dementia in their communities. So again, all of these programs were done through partnerships, really working to implement that roadmap for Indian country. And so I just want to thank these partners and the teams and leaders of the tribes who are really leading this important work. So if you want to learn more, please visit our website or reach out. We also have a newsletter you can subscribe to through the website. So thank you again.
Thanks so much, Eva. One of the things I really appreciate about this approach and with the roadmap is that as you said, it's like a conversation starter, right? It's a guide to help tribes, tribal organizations start that conversation around Alzheimer's and dementia, but that it's really up to the tribes to determine where do they want to start and what the conversation should look like, and what's the best approach, knowing that they have the expertise and the pulse on their own community. And so the examples you gave, such different ways of looking at it and different approaches. Thank you. So we do have some questions here, and I also want to mention, and if I didn't mention before, I am with the Alzheimer's Association, and my role is Director of Diversity, Equity, and Inclusion. And there are three big buckets of how we're looking at pursuing health equity in our vision of a world without Alzheimer's. And first and foremost is, or not foremost, but one of the approaches is to look at research. And as we're looking at research in so many different ways, it's also important to understand why some communities, some populations are more affected than others. And so investing in research that really focuses on specific populations and understanding the disparities is critical. The second area is around advocacy, and to advocate for health equity, but also in the sense of looking at policies such as a recent bill called ENACT Act, which is really trying to get at making sure that we have diverse representation when we are looking at clinical studies or anything, that we have a representation of many segments of our population, including American Indians and Alaska Natives. And then the third area is to make sure that families and communities have access to whatever information and resources are available. And so we certainly have our 24/7 helpline that's available that anyone can call if they have concerns about Alzheimer's or memory concerns, or how to navigate the situation, whether it's individually or even collectively in a family or multiple settings. We have expertise there that can guide you, professionals who can answer your phone calls. And then we certainly also have our web page, Native Americans and Alzheimer's, that we'll make sure to put in the chat, where you can find the roadmap there, and some of these other things that we've mentioned, including some of our partners that we've talked about. So I wanted to bring that up. And then the other approach around our work is around these partnerships. And so partnering with, again, IHS and NICOA, and working closely with IA Squared on the roadmap for Indian country. Those are all really critical, and we look forward to working with local partners as well. And so whether it be the Indian Health Board at a local level or other tribal organizations, the Alzheimer's Association, we have over close to 80 chapters across the country, and we're all very open and wanting to do our best part to support Indian country as we're dealing with Alzheimer's. So I want to go ahead and address some of these questions that we have. And one of the first ones here is asking about how we can develop a physician-led Indigenous medical education type of program. So to explore physician and nurses' knowledge and experience in Indigenous communities. I wonder if anyone wants to take an attempt at answering that one. Developing culturally safe approaches to dementia and Alzheimer's care that enable, but really looking at physician-led Indigenous medical education to explore how we address this in communities in a culturally relevant way.
I'll take a stab, and I'm sure Bruce and Valerie from my team are on the phone in my first, solo ride here. Hopefully I don't get myself in trouble, but I thank you for the question. And our intent, as we talked about those buckets, is to work on workforce training enhancement and capacity building. And I think, kind of true to the way that the team seems to work and the way that IHS, my takeaway in the short period of time, works is working with staff to develop what staff need. That doesn't mean necessarily that all IHS staff are themselves Native. However, I think we need to center ourselves. We recognize the value of centering ourselves in content, much like Mary Ann talked about, kind of by and for the people that we hope to serve. And so that is one of the reasons, for instance, that we wouldn't just take someone's, competency or training with CME off a shelf and say, here, thank you, and then just use it that way. But our intent would be to work on adaptations and identify cultural nuances where it's appropriate. So hopefully that helps answer the question.
Great, thank you. I have a question here, and maybe Larry, I want to look to you to think about this. It's related to caregivers, and so caregivers are the backbone of our dementia care system. Not everyone identifies as caregivers, and so what is the most effective way to engage Indigenous caregivers and make sure that they have the resources they need to not only be successful in caring for their loved one, but also for themselves?
Well, I think one of the things that we have been learning is that among different tribes and different organizations out there in Indian country, that there are some who understand what caregiving is, what it really means. And then there are other tribes who don't attest to the word, that it's a foreign concept. But in those communities where they're a little bit more traditional, with a little bit more traditional values still hanging in there, that they look at that word as totally alien. They look at it as more as a natural process. It's a natural part of the community, that there's a responsibility there. And I know that in some of the studies that have been done, that 60% of the caregivers are women in Indian country, and so in a lot of ways, there's that gender difference, because it's the woman or the daughter that's taking care of a parent or a parent-in-law. That's what we're seeing out there. But I think that this conversation becomes even more complicated when you think about, okay, so this is a situation now. What about 10 years from now? What about 15, 20 years from now? Those questions I have, because when I think about caregivers, if we have 70% of the American Indian, Alaska Native population now living in urban areas off reservation, who's going to provide the care back home? Long distance caregiving doesn't work. And so what's the alternative? And I know that in this day and age, there's this mantra of aging in home. Take care of them in the home, let them age in the home. But when you're talking about 503,000 older Indians today, and if we're talking about 1 in 3, we're talking about 150,000 that could potentially end up. And where are they going to go? And we don't have the caregivers in the community to provide that level of care. And so what is it? I am looking, like I said, 15, 20 years down the line. Right now in the Indian country, there are, I believe, only 23 nursing homes, long-term care facilities, with a bed capacity of less than 1,000. So 150,000, only 1,000 beds. Where are they going to go? And that, explodes into another question. If those elders are going to be going into off-reservation long-term care facilities, who is going to be looking out for their welfare? On the other end of the age spectrum, we have the Indian Child Welfare Act that looks after our young population, so that tribes still have jurisdiction over a Navajo child, for example, in New York City. What about our elders who end up in a nursing home off reservation? And the tribe, in my view, I think, needs to begin to think about elder protection, similar to the Indian Welfare Act for children. But, that's my thinking 20 years down the line. And I think that we ought not to sometimes be caught looking at the sun as it's setting on us. Just a comment and just my thought for a response to that question.
Yeah, I appreciate your response, Larry. And certainly there's no one simple answer to that, and forecasting what some of these other issues will come ahead is certainly something worth thinking about. I don't know if, one of the questions that was also asked was, all of these organizations are doing great work. Is there any overlap? Is there any intersection in terms of what we're doing? So I don't know, Marianne or Jolie, do you want to talk about how you work with other organizations? Marianne?
Yeah, I mean, at I-Squared, we partner with a lot of organizations and tribal communities and tribes. For example, with our Wandering Project, we partnered directly with the Pyramid Lake Paiute tribe, and we're helping them with implementing that project, getting it on the ground and actually helping with the search and rescue and that whole process. the same case went for, we had actually a respite care grant program that we were putting on. Similarly, a situation like Larry said, we ran into the problem where a lot of folks were not identifying as caregivers, and so they weren't applying for the opportunity that we had. So, I think it just all kind of comes full circle, and the education and continuing to push opportunities, and it's all important. So yeah, we try to work together. We try to keep our communities involved and in the loop, and participating with us so that we can be direct and help them in the ways that they need. So
I would say I think this is actually the first time all of this group has been together, maybe. And just this webinar to me is a really great first step in that process. When I was at I2, we have a national advisory group, and someone from all of the organizations on the call today and groups were on that advisory group. And so I think that was a good way, and I2 is doing a great job in that space, trying to keep people connected as well. And so I really look forward to the opportunity here and now that IHS has more, a couple more players in the game, to be able to engage in that space. And then Edie, we have the MOU with you guys that was signed last year, and we're trying to work to renew that. But I also think that MOU will create some opportunities, hopefully, for us looking forwards as we are thinking more about our plans and things like that. So,
yeah, thank you. So yeah, I'm struck by your comment that, is this really the first time we've all been together, right, in one space via this webinar? And I hope it's not the last, because certainly there is plenty of work for us to do together, and we welcome so many others to join us in this movement, right? As Larry is bringing up so many other issues, there are upstream issues, and one person commented, it's not even 20 years down the line, it's today. We have to think about these things today. Maybe a final thought from all of you in terms of how can, I know we wanted to pose this to our audience, but how can we support those in the communities more in terms of what we're trying to do to address Alzheimer's and caregiving issues, certainly, but there's a lot to tackle here. But one final thought in terms of what we can do more to offer for Indian country. Why don't we start with Larry, if you're able to speak? Wanted to just give you an opportunity to share one final thought in terms of what we can do to support our tribal communities, our Indigenous people in terms of Alzheimer's and caregiving.
Well, for me, I think that one of the things I'm looking at is all of this information and all of these toolkits that are available out there. That, if you want to put them all together, there should be at least one pathway to helping a population. And as I said before, and I think it was Eva mentioned that each one of these tribes are different in terms of cultural values. And so that in all of these packets of information, toolkits that are available out there, there should be at least one that fits that particular community. But to understand that I think one of the big problems has been the whole issue of stigmatizing people. And I think that we need to move past that and provide that kind of information. I know that Jolie, when she was working at I2, a lot of that kind of information was coming out of the advisory group that she was working with. And finally, I think, like, for example, with us at the National Indian Council on Aging, we have our NICOA, NICOA.org. There's a compass site that provides a lot of information on long-term care facilities, assisted living facilities, coordinating those services at the local level, how that can be done, and nutritional value information, games to stimulate your brain, all of that on that
Yeah.
side.
That's wonderful. And NICOA has their biannual conference, right? And that will be in 2023. And that may be an opportunity for people to learn more, possibly, around caregiving and Alzheimer's. Thank you. Okay, Jolie, any final thoughts here?
Well, if you know me, you know I always have thoughts, but I'm trying to focus and kind of keep it tight. And was looking back on some notes I jotted down. And I think the most important was kind of the last, which is dementia is everywhere, whether it's undiagnosed or not. Whether the systems are finding it or people want to recognize, or families and those types of things. And caregivers are everywhere, whether formally recognized or not. And as you said, I think there's a lot of work that has to be done, and that's all going to take time and patience and persistence and really an infrastructure. And I think, this call demonstrates a lot of the solid infrastructure that we're working on. And hopefully we can kind of all work together moving forwards, because I really do think that's critical, because no single person on the screen right now or anywhere can do this by themselves, because there's just so much need out there. So I think that's probably it. Would say to anybody who's on the phone who's not currently working with or has experience working with tribal entities, learn, make effort to learn, reach out, don't come in with your assumptions and don't come in with your needs, and recognize the importance of sovereignty in those communities to define and identify and address the things that they're priorities. So thank you so much to you. And I mean, there were so many questions, I think it was hard to answer them all. So I think that just signals like a lot of great interest.
Yeah, thank you. And I know we do have some questions that we weren't able to get to. We're just tight on time here, but we certainly will try to answer them the best we can. And I'll make sure to share my email address here with all of you. So any thoughts that you all have in terms of what we can do better to support all of your work and to partner with all of you, please let us know. Marianne, let me make sure you get a final comment before we close out, and then Eva.
Yeah, again, I just want to say thank you for letting me be here and to share all that we're working on. I would say like one of our main priorities at IA Squared is to stay connected with our community members, to hear what everybody has to say, to recognize that all of the inputs are important. And we try to mimic that out in our resources by providing a lot of different design options and opportunities for people to be able to participate and use what we have to offer. So we always appreciate people reaching out to us. And yeah, again, we're going to have a lot more things coming out, and year 3 is, upon us. So there's going to be even more happening then. So follow us on Facebook, follow our website. We're always sharing. So yeah, thank you again.
Yeah, absolutely. Thank you. And Eva, any final thoughts before we close out?
I think just that one of the great things about being in public health is that we get to kind of hear and share the stories of success as well, and make sure that others know what other communities are doing, so that they can be adapted for their individual communities and needs. So if you have any of those stories that you'd love to share, we'd love to hear that and be able to be a resource to make sure others know about the work as well.
Yeah, terrific. Thank you. Well, I want to thank the panelists. Thank you all so much for joining us. And we definitely need to do this again. And perhaps maybe in 6 months or a year, we'll have even more to report out on the progress of the work, because we're just really starting to get started, but there's some momentum here. Larry, thank you for your prayer and for all of your expertise and wisdom. Thank you all for joining us, and this concludes our webinar. Please look us up, and yes, we will try to share the slides. We'll send out the recording. If you've registered, you'll get the recording at the very least. So thanks so much. Take care, everyone. Bye-bye.